So yesterday I talked about the consequences of having some kind of a surgical procedure here on the chest wall going in and affecting your lungs. Now what I want to talk about is your lungs themselves. So the lungs are actually up here. They're at the top of the lung is actually here. It comes that high. And then it only goes down to about mid-breast level. So it doesn't go all the way down. It's so funny how we think so. It does go lower in the back, slightly lower in the back. There are 3 layers of membranes or fascia around the lungs. The first is the pleura that we've all heard of. And the pleura is wrapped around not only each of the lobes of the lungs, so it actually goes in between the lobes. We also have the next layer, which is called the cirrus layer, and that's a semi-viscous layer, meaning it's a little bit fluidy. And then we have the outside layer, which is the parietal layer. Now, one thing that happens is that if I have pneumonia, bronchitis, and any of the kinds of things that will, asthma, COPD, these kinds of things that they'll leave scarring or scar tissue within the lung itself. When that starts to happen, what it also does is takes these 3 layers of fascia and adhere them together and adhere them to the lung itself. And I do want you to know that a lot of people actually don't breathe well into their lungs. A lot of yoga practices do have that, but most people don't breathe enough in here. And the other thing is that what are some of the consequences of having scarring in the lungs as well as adhesions on these fascias is that 1, I can have neck pain. 2, I can have pain in the middle, inside deep. It feels like it's inside deep in my shoulder blade. What it can do is come and start restricting the shoulder and lock up the shoulder and give me shoulder and arm pain. So there's a lot of things that can happen when we get things that going on, like the repeated pneumonias, the repeated bronchitis, the asthma, and those kinds of things. Hey, I've been putting together my gut talk that's on the 15th. I'm rather excited about it. I hope I don't flop and fall on my belly. But I see you guys tomorrow, and also I'll see you on that 15th Sunday at 3 o'clock for the gut.